coming here today. And thank you, Waylon, for hosting this event. So this is Medicare 101. It's a basic presentation that will give you all the information you need as you begin Medicare. And so it's really beneficial for those of you who haven't started Medicare yet. If you've already started, you'll still learn some things you probably didn't know, and hopefully some things about when you can make changes and how your decisions will impact you going forward. So I'm Billie Lister. I'm the Western Regional Manager for the SHIIP program, and SHIIP stands for Seniors Health Insurance Information. And technically I do have a Raleigh office. I'm never there. I'm there maybe one day here and there. But I'm usually working out of Ashe County, and I manage all of the counties between Ashe and all the way down to Cleveland and all the way out to Cherokee County and Murphy. So if you have questions, there is a local SHIIP site in every county in North Carolina. And here, that is, of course, the McDowell County Senior Center. Oh, thank you. Sorry about that. Is that better? I usually project. I have a loud voice, so it's okay. So Waylon is your coordinator here in McDowell County. So if you want to come and talk to him, you'll always have somebody right here in McDowell County that can help you with any Medicare questions, and we encourage you to call here at the Senior Center and make an appointment as you need to. So what is Medicare? It is a federally funded individual health insurance program. It will provide coverage for medically necessary procedures, services, and medical supplies and equipment. It is a federal program, and you become eligible when you're 65 or older if you've participated in Social Security or the Railroad Retirement System. Now, employees of federal, state, or local governments and their spouses are also eligible. And then if you're under 65 and you're awarded disability by the Social Security Administration or the Railroad Department, after you've been on disability continuously for 2 years, you'll automatically transition to Medicare. If you become diagnosed with ALS or Lou Gehrig's disease, or if you get a diagnosis of end-stage renal disease, you'll also become automatically eligible for Medicare. And so your Medicare would begin the day your disability is officially started. So let's talk about administration and enrollment in Medicare, because this is where it's really important to understand that there's only one way to get into Medicare, and that is through CMS or through Social Security Administration. So while CMS manages your Medicare claims, they don't enroll you in Medicare initially. The Social Security Administration does. And so CMS is obviously a federal government, and it's a branch of the Department of Health and Human Services. And then the Social Security Administration is also federal, and they just determine your eligibility and enroll you in Medicare. Now, once you're enrolled in Medicare, all the other stuff is going to be handled through CMS. And so the claims and those kinds of things are handled by the federal government. Now that we know how we enroll and who we go to enroll, we need to talk about who needs to actually initiate enrollment and who would not. If you're if you're turning 65 and you received your Social Security benefit check before you turn 65, then they're going to automatically enroll you. And about 3 months before you turn 65, you're going to go ahead and get that Medicare card in the mail, and it's going to tell you that it's going to start the first day of the month you turn 65. Okay? Now, any of you born on the first day of the month, your Medicare will actually begin the month before, which is surprising, but being born on the first gives you an extra month of eligibility. Other than that, if you're not receiving your Social Security benefit and you're not disabled and on disability for 2 years, you're not going to be automatically enrolled. So it's going to be super important to understand your initial enrollment period. It begins 3 months before you turn 65, and it will continue through the month you're turning 65, and it will be 3 months after. As long as you enroll within that 7-month period, you would not be subject to a late enrollment penalty. And that's important to know, because if you do become subject to late enrollment penalties, they are lifetime. And they are not forgivable, unfortunately. So it's very important that you Don't miss the boat, that you get on board when you should enroll in Medicare. So if you enroll in one of those 3 months before you turn 65, your Medicare will start the month that you turn 65 unless you were born on the 1st. And then if you enroll during the month you're turning 65 or one of those 3 months after, your Medicare will actually begin the next month after that application is processed. So that is also important to know, is when you want to start, right? Like, how do I need this to begin? When am I losing my former coverage? And so you want to have a smooth transition and not miss. So while you do have this entire 7-month period to start this journey, I'm going to tell you, like my grandma said, don't you lollygag, start 3 months early, because none of this stuff is going to be quick and easy necessarily. You're going to have to call the Social Security office or log in, and it may take a minute for that application to get processed. And so if you're starting the 3 months out and you can't get an appointment with Social Security, or you can't figure out the online piece of this, you could potentially be setting yourself up for some late enrollment penalties because you didn't get it done on time. So always try to start the 3 months prior if you can, and that way you're making sure everything's going to start on time like it should. And they are a bit late at the Social Security office. So some of their agencies have experienced staffing issues, so we want to make sure to give them lots of time to process that application. So let's say you miss it, what happens then? Well, don't worry, there is a general enrollment period, and it's January 1st through March the 31st every single year. That's called general enrollment. So if you missed it and you did not hit your initial enrollment when you should have, during general enrollment you can enroll. So if you enroll in January, your Medicare benefits will begin in February. If you enroll in March, for example, it's going to start in April. So you just want to make sure that you jump on a first opportunity, because the late enrollment penalties are 10% on Medicare Part B onto that current year premium for every year you miss. So if you miss it for 5 years, they're going to add 10% for each of those 5 years you missed, and that's going to accrue and be quite drastic. And then it will also apply to your Medicare Part D drug plan. So when you get drug coverage, you'll have an actual 12% penalty, because it's 1% per month, so 12% per year for every year you miss. So you don't want to miss enrollment in Medicare when you're supposed to enroll, because those penalties are lifetime and they keep getting worse each year. So we want you to go ahead and jump on board the next chance you get. What if you were still working? That means you can potentially delay taking Medicare. You don't necessarily have to enroll at 65 if you're working full-time and covered continuously under an employer group health plan. But I always caution folks, go easy with that decision before you decide whether or not you're going to enroll, because your employer may require you to take Medicare when you become eligible. In addition to your employer maybe perhaps requiring that, maybe your employer plan is not as good as Medicare. Or maybe your employer would be secondary to Medicare, meaning even though the employer will allow you to stay, the insurance company wouldn't pay claims that would have been paid by Medicare. So it's very important to ask a lot of questions before you turn that down at 65 or before you decide to delay. And of course, we're going to encourage you to sit down with a SHIIP counselor and kind of weigh out that decision and decide, really, should I delay or should I go ahead and take it? If you were eligible to delay taking Medicare Part B or A, if you're eligible to delay because you're working and covered under an employer plan, you will get a special enrollment period when you're going to retire, and that's going to allow you to enroll without penalty, but you'll have additional forms that you have to turn in that prove from your employer that you were working and covered under their plan. And that will help you get out of those late enrollment penalties later. So we kind of talked about this earlier, but the Social Security Administration is the only way to enroll, but let's talk about how you complete that enrollment. So you can go to ssa.gov and apply online. You'll create an ID.me or a login.gov account. And if you say, ooh, I'm not good at that kind of thing and I don't really like technology and computers, it's okay. You don't have to do it online. If you don't want to do that online, you just give them a call. Now, the number that's on the screen, the 1-800-772-1213, is the National Social Security Hotline. You will be on the phone longer if you call that. It will probably be easier for you to call your local office. And so Waylon can hook you up with that number and help you with that. So all you have to do is call here to the Senior Center. Someone can help put you in touch with the correct number to call. But if you call their office, they're not going to help you the second you call. They're going to make you make an appointment for enrollment. If I know my window opens in April, the very first couple of days of April, I'm going to call the Social Security office and I'm going to say, look, I'm turning 65 in 3 months. I need Medicare. And they're going to say, okay, let me give you an appointment in your window. And they're going to try to accommodate my window of need. And they're going to take care of that over the phone. It is not a complicated process. You cannot, however, just go to the office and walk in. They will no longer allow walk-in appointments. So you do have to call and make an appointment. Now, if you want a face-to-face appointment, they will give you one, but you have to call ahead and make it ahead of time. No walk-ins. Now that we know when to enroll and who should enroll and how to enroll, let's talk about what are we enrolling in. So Medicare has 4 main components. And notice I didn't say Medicare parts or plans yet. We're talking about the components, the building blocks. So what is Medicare made up of? Medicare Part A is your inpatient or hospital coverage. Medicare Part B is outpatient medical coverage. And everybody starts there. So when you call the Social Security office, that's all they're going to give you is Medicare A and B. They're not going to answer questions about Part C or D. They're not going to talk to you about supplements. All they're going to do is enroll you in original Medicare A and B and take your $202.90 for Part B and tell you if you have to pay for Part A. That's what the Social Security does. They determine if you're eligible, enroll you initially in the program for A and B, and take your premiums, okay? Now, when you're off the phone with them, that's when you need to sit down and decide what other parts of Medicare do I need. So there are 2 other main building blocks. There are Part C Advantage plans. Those are private companies who contract with Medicare to manage your benefit instead of the federal government, okay? So the federal government pays them a contractual amount to handle your claims and process your claims instead of Uncle Sam, okay? Then we have Medicare Part D, which are private companies who contract with Medicare to provide you prescription drug coverage, which you are required to have prescription drug coverage of some kind. Having said that, you can see there are 2 paths to Medicare. There is the original Medicare path, and if you stay on that original Medicare, the federal government, or CMS, directly handles all of your claims. So they're going to take all of the claims from your doctors, they're going to look at them, decide if it's qualified, or if that is something that they cover, they're going to pay their part, they're going to send the rest of the bill to you, okay? If you keep original Medicare, at a minimum, you need drug coverage. So you'll have to have either a Medicare Part D plan or some other type of creditable drug coverage. And in addition, you can choose, if you want, to also carry an optional Medicare supplemental plan. And we're going to talk about whether that's a good idea or a bad idea, and what that kind of means for you. But the Medicare supplement is completely optional, but recommended if you keep original Medicare. Now, if you decide to leave the original Medicare path, you can get on the Advantage Plan path, and then you will select a private company who contracts with Medicare, and they will manage your medical benefits instead. Because everybody starts with original Medicare, we're also going to start with original Medicare today. So what will original Medicare cover for you? Your Medicare Part A, because it's inpatient, covers you anytime you're admitted to the hospital. It also covers you when you're admitted to a skilled nursing facility. Of course, it will require that you're in the hospital for 3 days or longer before being admitted. It will cover some home health care, it will cover hospice, and it will cover blood transfusions. Now, again, those claims are all going to be processed directly by the federal government. Medicare Part B is everything else that's outpatient. So when I go to the doctor, if I go to a specialist, if I go and have an x-ray, if I'm in the ER or I have outpatient surgery, if I need durable medical equipment, most of the home health stuff is billed under Part B. Also, preventative care is billed under Part B. as well as outpatient blood transfusions. So all of those things are billed under Part B. Now, what's not covered? Original Medicare is not going to cover your outpatient prescription medications, and that's why they require you to have some kind of drug coverage. Also, routine dental care is not covered by Original Medicare. However, if you get in a car accident, you break your jaw, you need maxillofacial surgery, if you get oral cancer, those things are considered a covered service under Medicare. You also will not be able to obtain routine vision care and eyeglasses. So the cheaters that I buy at the Dollar Tree, not going to be covered by Medicare, right? But if I just need an eye health exam each year, my annual exam is covered at 100% as preventative care. Also, if I get glaucoma or if I need cataract surgery, those are covered by Medicare. So I kind of think it's everything that relates to the eyeball is covered. Your eye health is covered, but the vision coming out of them, not covered. So you're not going to be able to get your glasses, but you will certainly get eye health care under Medicare, okay? Same thing happens with hearing. I can go to the doctor and find out why I can't hear. I can get an exam, and that would be covered, but I will not get hearing aids, okay? Foreign travel is not covered, although some supplemental coverage is available if you have a supplemental plan. And of course, anything cosmetic is not covered. So if you need cosmetic surgeries, you need to do those before you start Medicare, or you'll be paying for that out of pocket. And long-term care, never covered by Medicare. This is one of the harder pills for most people to swallow. 1 in 3 Americans will need long-term care. And long-term care is defined as needing more than 100 days of inpatient care at a skilled nursing facility, not going to be covered by Medicare. So that will be problematic. And unfortunately, by the time we're on Medicare, generally, we're unable to purchase a long-term care policy. So we needed to have thought about that early on and got that policy in place before the start of Medicare. But I do encourage you to see what's out there and what you can obtain in terms of long-term care. Now, this is what a Medicare card looks like. Of course, John Smith isn't real. I mean, he is, I'm sure somewhere there's a John Smith. But this particular card is not real. We would never put a real number up there. But what I will say is this is a paper card. It is a paper red, white, blue card. If you have some knucklehead calling you saying, I'll give you a plastic card, it's a scam. Hear me clear, it's a scam. Don't give up your number. In fact, don't even answer the phone. It's almost always a scam. But this is a paper card. We can get you a copy of that, but once you've given that number to your medical provider, you really don't have to carry it around. It's okay. They can look that up for you anyway, so it's not a big deal. But it is not plastic. So let's talk about what Original Medicare will cost for you. Now, I'm going to put my cheaters on. I did pay a whole $1.25 for them, so I'll use them today. With Medicare Part A, the majority of you will not have a premium. You will not have to pay for Medicare Part A if you've worked 10 years and paid your FICA taxes. And so that's what the Medicare taxes that we pay are for. It's to pay for this premium for Medicare Part A. Now, if you have not, for some reason, worked 10 years or paid taxes, sometimes we work 10 years but we don't haven't paid those taxes. So if that's the case, the premium for Part A is $565 a month. Now, if you've worked, between 30 and 40 quarters, you're going to pay $311 a month. So it's still a lot of money, but the majority of you will get that for zero premium. You will have already taken care of that. Now, for that, there is a incident period or benefit period deductible of $1,736, which means if I have Original Medicare and only Original Medicare, the second I'm admitted to the hospital, I have a deductible of $1,736, and that will be my part to pay. And once I've met that deductible, I can get up to 60 days of inpatient care at no additional copay. Okay, and that's pretty good. That's not bad. It's not great. None of us like to pay a deductible, but it's not a terrible deductible. Now, should I need more than 60 days of inpatient care, days 61 through 90 are $434 per day copay, and then days 91 through 150 are lifetime reserve days. They're only paid once in our life. So those particular 60 days are $868 per day copays, okay? When I say that this is a benefit period deductible, that does mean that unfortunately it's not calendar year. This could potentially repeat. So if you're in the hospital and you met that deductible and you get discharged and you go home, it starts the clock. If you're home for 60 days and day 61 you get readmitted to the hospital, you're going to have to pay the deductible again. That's a new benefit period. So it can potentially repeat every 60 days if I'm out of the hospital for 60 days, right? So every time I'm home 60 days, it's going to reset that deductible, okay? Now, if I should need skilled nursing, the great thing about Medicare is if I've spent 3 or more days in the hospital, but I still am not quite ready to go home, I can go to skilled nursing. Within that 60-day incident period, I can go to skilled nursing, and I could potentially get up to 100 days of inpatient care there. If that's the case, now I have to meet certain criteria, right? It's got to be short-term, not long-term care. So I'm just there for rehab, and I'm cooperating with the rehab, and I'm making progress towards going home, then Medicare will pay for that rehab stay. The first 20 days are zero copay. I don't pay a dime for them. But after 20 days, I'm going to pay $217 per day up to that day 100. Now, past 100, it's long-term care. Medicare's out. Okay, they're not going to take care of it. Home health is usually covered at 100%. Durable medical equipment is covered at 80%. Hospice care is usually 100% covered. And then blood transfusions are covered except for the first 3 pints each calendar year. So if you've ever had blood, you know that is not a cheap bill right there. That's very expensive. And the first 3 pints are on you, okay? Now, let's talk about Medicare Part B. And that's the one that I feel like the majority of us are going to use the most of, right? We'll probably use that Part B benefit more than we'll use the Part A. Part B is $202.90 for 2026. That was a big jump over last year. Does it go up absolutely every year? Almost every year. I've only known it to go down once, never known it to stay the same. So does it increase? Yes, it will probably increase as you age. Not because you're aging, just because cost of living, that's what happens, okay? So for the $202.90, what are you getting in exchange for that? Well, you're getting basically an 80-20 split with the federal government. So there is a calendar year deductible on Part B of $283. Once you meet your $283 calendar deductible, Original Medicare has no networks, no hoops to jump through. Just go to any medical provider that will accept someone with Medicare. It's about 99.9% of them, right? Short of maybe plastic surgeons and maxillofacial surgeons. Pretty much everybody takes Original Medicare. Go into the doctor, pay your annual deductible one time, and then Uncle Sam pays $80, you pay $20. Now, is it just that simple? I would love to say yes, but I don't lie. So it's not always that simple, okay? So there's something called excess charges. If your doctor does not accept the Medicare assigned reimbursement rate, they can charge you 15% of what they've lost in that negotiation. So in other words, if I go to the dermatologist, you know how they always want a piece of you. They get a little piece of me, they send the bill into Medicare, and they say that was worth $500. Medicare may look at that and say, that's only worth $300. Well, what happened to that $200? The doctor can either eat it and just take the reimbursement rate that Medicare offered, or they can say, I don't accept that, and they turn around and charge you 15% of the $200 that they lost. So that 15% is called excess charges. That's 100% your problem. Okay? You will have to pay that if your doctor charges it. Do all doctors charge it? No. But some do, and it is a little more prevalent today than it was even 5 years ago. Okay? So it is something to think about, something I try to warn people about. It can happen. Outside of that, preventative care is always covered by Medicare at 100%, but you have to be careful how you word it. So when I say you're going to get a preventative health exam, that is not the same thing as a physical. So if you call your doctor's office and you schedule a physical, an annual physical is actually billed and tied to work. Therefore, Medicare is not paying for that. They will pay for an annual health exam or an annual Medicare preventative exam. So it's all about the way you word it and the way the doctor's office codes that bill. Okay? If you want Medicare to pay for it, you got to code it correctly. And most doctor's offices know this, but again, if you call and specifically say, I want to schedule a physical, you're not going to get that covered by Medicare at 100%. So just be aware of that. And the same thing happens with a lot of preventative exams. So if I'm due for a mammogram, but I say I have a problem, I think I have something I feel, now it's a diagnostic mammogram, that's not free. Is it the same exam? Yes, but it's different. Now they're looking for something specific, not just a preventative exam. Does that make sense? Gotta be careful with that preventative care. But if it's truly preventative care and it's coded as preventative care, you're going to get it at zero copay. Same thing with home health care. You're going to get that at 100% coverage. And then any outpatient stuff that you have done, whether it's surgeries or whatever, the federal government will pay 80%. You're going to pay 20% after you've met that annual deductible. The difference comes when we get to those blood transfusions. Again, you have to pay for the first 3 pints. And after that, from the 4th pint on, they're going to cover 80% if you've met your deductible, and you're going to pay the rest. So most of us would think that 80-20 split, that's pretty good coverage for $200 and $290, but $200 and $290 can be a little frightening. And just remember, not everybody pays the $202.90. You may qualify for a program that pays your Part B premium for you. So if you have very limited income or very limited assets, you may qualify for a Medicaid product called the Medicare Savings Program, and it will pay that premium for you. You may make more than $109,000 as an individual or more than $218,000 per year as a married couple, and so you would be subject to IRMA, income-related monthly adjustment amount, and if you're subject to IRMA, you will pay more than $202.90. And how much more depends on how much more you make, right? So the more you make, the more you pay. If you are on Medicare due to end-stage renal disease and you receive a kidney transplant, you will lose your Medicare coverage 36 months after you get your kidney. But you can choose to keep immunosuppressive drug coverage for $121.60 per month. So that is one exception to regular Medicare that people should know about. Is if you do lose full Medicare because you got your kidney transplant, you can still get your kidney transplant rejection drugs without worrying about that. So we've talked about how much is and is not covered by Medicare, and if that kind of scares you to death, let's talk about Medicare supplement plans or Medigap policies. You'll hear them called both. But Medicare supplement plans are secondary coverage to Medicare, and they are truly optional. You are not required to have them. It is a very good idea, though. Why do I say that? Well, because while 20% doesn't sound like a lot, it would add up. If you have a very, very bad health year where you're having an MRI and a CAT scan and this outpatient surgery, that outpatient surgery, this inpatient care, and I'm in and out of the hospital all year and I'm having all kinds of things and I have a terrible health year, there's no maximum out of pocket with original Medicare. So my 20% just keeps going and going and going, and it never ends. That is a terrifying concept. And if I don't have a heart attack or a stroke and I haven't had a bad year, and maybe I don't have cancer and I'm not having a bad health year, it's not that bad to pay 20% of a few exams here and there. But when it's one thing after the other, it's pretty scary. And since we don't have a crystal ball and we can't predict how healthy we'll be over the course of our lifetime, we should consider a Medicare supplement. Now, Medicare supplements are not guaranteed to you. While they are optional, you are only guaranteed to be able to purchase a policy the first 6 months after you start Medicare A and B. So when you have Medicare A and B on board, you have 6 months in which to shop for a plan and grab it. And during that 6 months, they cannot count pre-existing conditions against you. They cannot base your policy off of your health or wellness scale. They cannot charge you more because you didn't have coverage coming into Medicare. They can refuse coverage of pre-existing conditions if you had no coverage before, but only for the first 6 months. They have to give you that policy, and they have to give it to you at the price they would give it to anyone else your age and gender. Okay? So they can ask you some few basic questions. Where do you live? And what gender are you? How old are you? Do you smoke? Those are the kinds of things that will dictate how much you will pay for this policy. Now, if you sit down with a SHIIP counselor, like myself or Waylon, we're going to walk you through all the different plan options. They are standardized. So what does that mean? Well, that means that out of these plans, if they say that this is a Medicare Part A plan, they have to cover all the things that are checked right there. So they're going to pay your Medicare Part A copay, your Medicare Part B copay, that 20%. They're going to pay for your first 3 pints of blood, and they're going to pay for your hospice copay. Okay? That's all that any Medicare Part A plan, supplemental Part A, has to pay. Okay? But there could be 35 companies that sell that plan. Why is one company $100 a month and another $300? Well, it's all about knowing how to shop for a Medicare supplemental plan. There are various things about each policy that you need to be aware of. Rating class, rating type, none of which we're going to talk about today, other than to say that when you sit down with someone and you're talking about Medicare supplement plans, it's very important for you to understand that they pay your share of what Medicare didn't pay. So if Medicare approves it, the plan has to approve it. And that gives you some guaranteed rights under that plan that you don't have to worry about, which means there's not going to be a network, there's not going to be any hoops to jump through. If Medicare covers it, your secondary kicks in and pays the rest. But it's only going to pay for the things it claims it's going to pay for. So you have to shop very wisely. Now, Medicare Plan G is the most comprehensive coverage available currently to new to Medicare members. It's the most bang for the buck, so we see that as being the most popular plan right now. Very few people that I have counseled have opted to go to other plans, but it doesn't mean other plans aren't a great option. They are. It depends on your needs and your situation, what would work best for you. Medicare is not one size fits all. I can never stress that enough. So no matter who you've talked to, your neighbor, your pastor, your doctor, your mama, your best friend, your brother, you got to set aside what they say, because that plan may be great and work perfect for them. It may be a disaster for you. And so we want you to understand exactly what each ramifications, what each plan would be and what those ramifications are for you personally. So if you tell me, I hate networks, I'm going to say you probably want to look at a supplement and original Medicare, right? If you're very, very sick and you don't have any other coverage and you're thinking you're going to stay on the original Medicare path, I'm going to say let's look at those supplemental plans and see if that would work for you. If you say I'm perfectly fine staying in the network because I only go to doctors locally and I'm not that unhealthy, I'm pretty well, we may be looking at Advantage plans, right? So it's going to be different for each person. And so we're going to ask you lots of nosy questions when you come into a SHIIP office. It's not because we're trying to get up in your business. We're trying to help you make the best decision for you. And then we'll let you know if you can change those decisions. So unfortunately, when it comes to Medicare supplement plans, you're only guaranteed that policy the first 6 months you become eligible for Medicare. So if you do not take a supplement initially, does that mean I can never get a supplement in the future? That's not exactly what it means, but it means I'm not guaranteed to get that policy. So if I call 5 years down the road and I attempt to obtain a supplement at that point, I'm going to have to undergo medical underwriting. And I might or might not pass that, right? So if I wait until I'm diagnosed with something like diabetes or heart disease, my chances of getting this are out the door, right? I had a person that came to me recently and said, well, I was very, very healthy when I took Medicare, and so I took an Advantage plan because it didn't really matter, and now I have cancer, and I'm having a hard time getting all my doctors and my chemo covered, and it would just be cheaper under a supplement like my neighbor did, well, unfortunately now she has cancer. No one's going to give her that plan. She's not in a guaranteed issue anymore. So the decisions you make at the beginning can potentially haunt you later on. Not necessarily, but it can. So we want you to understand that you really only have that 6 month of guaranteed right to get that plan. So if you want one, at the beginning is the time to do it, okay? And we can help you understand rating types, rating classes, and all the different plan options so that you can choose the company that's going to work the best for you. Because again, there's a bunch of companies that sell these, but they're not all the same premium. And you need to understand what those differences are so that you can make a good decision. Now, again, if we keep original Medicare, what do we have to do? We have to have some kind of drug coverage. So if you came to me and I will ask you, are you a veteran? Do you get your medicines from the VA? And if your answer is yes, then you probably don't need a drug plan because that's creditable, right? But most of you are going to have to take a drug plan, okay? Now, these are plans that contract with Medicare, so they're held to a certain standard, and we are able to look in that system and tell you absolutely every plan that's out there, every company, every premium, what drugs are covered, what drugs are not covered, and we'll tell you exactly what you can expect to pay for the year, okay? Now, in saying that, again, I'm going to say you will hear lots of people give you their opinion of who is the best drug plan. There is not a best drug plan. There's just not. There's not this plan is the best for everybody. It's about your specific drug list. So when you come in, we're going to ask you to bring a list of your medications so that we can punch those in exactly like they're prescribed, and we'll be able to tell you which plans offer all of your drugs on their formulary and which plans work with your specific pharmacy. And we can help you figure out if there's a cheaper pharmacy or if there's a cheaper way to go about it. We can help you find the best drug plan for you. Now, that being said, every drug plan has a premium, has a deductible each year, they have co-pays on those drugs, and they have a maximum out of pocket of $2,100. But if those drugs that you take are not on that plan's formulary, you will not be able to hold them to the $2,100 max. So it's important that you're making sure your drugs are on their formulary, okay? These plans do allow you to change once a year during annual open enrollment, and that is October 15th through December 7th. So when you start seeing pumpkins on the ground and trick-or-treat stuff in Walmart, it's time to call Waylon and make an appointment to come in and review that plan. Because even if you love it this year, all the things we just talked about, deductibles, premiums, co-pays, formularies, in-network pharmacies, they all change from one year to the next. So it's very important to do a review and not miss that review. So when can I actually enroll in a Medicare Part D plan? During your 7-month initial enrollment. As soon as you have a Medicare number, you can take a plan. Whether it's A or B, you can take a plan. And then, of course, that annual open enrollment, October 15th through December 7th. If you enroll during the annual open enrollment, your benefit will begin January the 1st. And then you could potentially have other times that you can join. So if you woke up on January 1st with an Advantage plan and you wanted to leave it and go back to original, they will allow you to make a change during Advantage open enrollment, one change. And then when you go back, they'll let you get a drug plan. And then you may actually qualify for a special enrollment period. If you move, if your plan has something bad happen to it and they stop selling in this area, or there are a plethora of reasons. If you become eligible for Medicaid or extra help, lots of things can make you eligible for a special enrollment window that would allow you to change more often. So again, you'll call here and someone here at the Senior Center will set you up an appointment to discuss special enrollment periods and determine if you can make changes outside of those normal enrollment periods. So that's kind of a good segue into this extra help program, because remember I said you might get a special enrollment period because you have extra help. Well, what is extra help? It's a federal program. Eligibility is determined through the Social Security Administration. If you have limited resources and assets, they may be able to take care of your premium, your copays, and your deductibles, or at least lessen them. Sometimes they're zero, and sometimes you're just paying a less amount. So it's very important that you understand, if you have this program, you have lots of opportunities to make changes in your drug plan. And so when you come in to see a SHIIP counselor, we will always screen you about your income, not because our services depend on your income. We don't care about your income. We help absolutely anyone that needs help. However, by screening you, if you do appear to be eligible, we will conduct that screening tool and we'll fill out your application for you. And then that kind of a one-stop shop, and you won't have to do it for yourself. We've talked all about original Medicare and what that looks like. Let's talk about Medicare Advantage plans and what they look like. So Medicare Advantage plans are just a different way of receiving your Medicare benefits. So instead of the federal government processing those Medicare claims, you would be selecting a private company, and that private company has a contract with Medicare and says, hey, if they choose me, I'll take care of all their claims. Now, in exchange for that, the federal government pays that plan to process your claims. They pay them what they feel they would have spent processing your claims. So they're going to get paid. So when you see these plans that say zero premium, they're getting paid. They're just not taking additional money from you. Okay? Some of them are, but not all of them. Most of them will say zero premium. And when you're looking at these plans, just know that as part of their contractual work with Medicare, they are allowed to give you new rules. So while original Medicare had no network, no hoops to jump through, right? You just go to the doctor, pay your part, Medicare pays its part, and everybody goes their separate ways. It's not the same with an Advantage plan, okay? With this Advantage plan, this company, yes, they process your claims, but they're going to give you a network. And you're going to need to use your network providers in order to make that plan pay the most. If you go outside of your network, they could pay zero or they could pay significantly less, okay? So it's important to understand that. But what you will get in exchange for that, for cooperation with the network, is lower copays. So instead of paying 20%, you may just pay $5 or $50 to see a specialist, or $0 to see your primary care doctor. It depends on the plan. They're all very, very different. And also, some of them will include your drug coverage for you. Some of them won't. And if you have an Advantage plan, you can't have anything else. You can't have a supplement. You can't have a drug plan. You can only have the Advantage plan. So it's important to choose carefully that Advantage plan. Some of them will say they give you dental benefits or vision benefits. You will hear on TV, not as often now, they kind of put a stop to a lot of the commercials, but you'll still see ads saying, check your zip code, we're going to give you free meals, free transportation. And when I hear I'm going to get free meals, what am I thinking? I'm going to get a meal delivered to my door every day. No, you're not. You're not. That's not true. What is true is if that plan says they'll give you free meals if you've been in the hospital a specific number of days and you discharge home, they will send a cooler of microwave meals to your front porch so that you don't have to cook for the first week or 2 weeks, right? It depends on the plan, how many meals and how many days stay it requires before you get those. But you'll get, it's like a styrofoam, it's like an old beer cooler. They just park it on your porch from UPS, and you have to get it in the house and microwave the meals. I don't know if they taste good or not. I don't know. I haven't had any of those meals, but I will say it's better than trying to cook for myself if I'm not able. Is that a great benefit to you? Absolutely. Wonderful. I don't have to worry about cooking when I get home from the hospital. However, I did have to make sure my hospital was in the network and that the doctor obtained all the prior authorizations before he did anything to me, because if he didn't get prior authorization or she didn't obtain prior authorization, they may not cover that procedure, right? So there are differences in how an Advantage plan works compared to how original Medicare works. You just have to understand the plan and how it works. But when you hear things on TV about, you're going to get $2,000 in free dental. It's not necessarily $2,000 in anything you want dental, right? You have to go to an in-network provider. That in-network provider has to obtain prior authorization. They have to agree that you need the procedure that the dentist said you needed. And then you still have to follow all the rules for that. So it's there, but there's a caveat to it, generally speaking, okay? So you have to be savvy and willing to investigate and make sure that the plan you're getting is what you think you're getting. And if they promise you something, you have to follow the rules to get them to fulfill that promise. So there are just rules. That's all I'm going to say. If you are a person that says, I will not be given rules, you do not want an Advantage plan. I promise you, you don't, because they're going to give you rules. But if you don't care about it and you're okay with rules, this can save you a lot of money. Because, again, if you can find a plan that's 0 premium, which you probably will, if you don't use it, you don't spend any money. But remember, under that supplement plan, I had to pay that company to cover my secondary coverage. Whether I use it or not, I pay the same thing. But under this, I don't pay unless I use it. So I have co-pays. Now, they also have a maximum out of pocket, and as long as I'm following the rules, they are guaranteeing me a maximum out of pocket won't exceed this amount. It's generally more than the premiums would have been under a supplement. But again, I'm hedging how many years will I not ever meet the maximum versus how many years would I, which one is going to, I don't know. I can't answer that for you. Waylon cannot answer that for you. I wish we could. If we were psychic, we would tell you which one will end up being the best overall, but I can't tell you that right now. So I have to say, follow your gut. If you're very, very sick, if you have doctors in lots of counties, if you have a complicated health history, if you don't like rules and you don't want to be on the phone figuring out who's in the network, don't go with an Advantage. If you can afford a supplement, take original. But that is a very individualized decision, right? And I have family members with both sides of it. Some have Advantage plans. Some have original Medicare with a supplement. It's different, okay? Do they all get care when they need it? Yes. Some of them just have more phone calls to make or more hoops to jump through. But in the end, they usually are getting about equal treatment. It depends on the situation. So sometimes it feels unfair if they're denied something under an Advantage plan and we're filing appeals, but we don't always have a guaranteed win for those appeals, right? So, but we just want you to understand what your options are. Now, if you've never tried an Advantage plan before, and it's your very first time ever, you do have a first year trial right period. So the very first time ever I'm on an Advantage plan, I have 1 year to come back with no harm, no foul, and I can take the supplement back that I gave up to take this, okay? If that's the case, if it's my very first time ever. So you can try this if you would like to try it, and it won't hurt you to try it, and at any time you can come back, and you'll be okay in that first year. So I do want to urge you to, to think about things, but don't fall prey to giving up a Medicare number without checking into something first. Make sure you understand your decisions and what will happen if you do make a change. Now, when can I enroll in an Advantage plan? Obviously, when I'm new to Medicare and I initially enroll, and then, of course, during the Medicare open enrollment period, October 15th through December 7th, and that would have coverage beginning January the 1st. And then during the Medicare Advantage open enrollment. So during Medicare Advantage open enrollment, you can only make one change in those 3 months. But from January to March each year, if you have an Advantage plan on January 1st, you can leave it and change it to a different plan. Or even go back to original Medicare and pick up a drug plan, okay? And then, of course, you have much more potential for special enrollment periods during Advantage plans. There are a lot of special enrollment periods that apply only to Advantage plans. And again, if you are unhappy in your current plan, call us, make an appointment. Let us help figure out if you're subject to one of those special enrollment periods. We'll help you make a change. All right, so let's do a quick recap. Original Medicare versus a Medicare Advantage plan. They both require you to have Medicare A and B. You cannot have an Advantage plan and you cannot have a supplement if you did not first start with Medicare A and B, original Medicare. Okay, so you start there, and if you have Medicare A and B, you can opt to either keep original Medicare, which will provide the care directly to you. You will have your choice of doctors, no network, and generally you or your supplement are going to pay your copays and deductibles. And you're going to probably have a premium for Part B unless you qualify for that Medicaid program to pay that for you. Now, under your Advantage plan, again, you'll have Medicare A and B, but you may also have some vision or dental or other meals, transportation, whatever that it says it offers. And this coverage is going to be provided to you by a private company who contracts with Medicare. And in all of these plans, you're going to have a network, and that using that network means you pay less. Going outside that network means you pay more or all of that bill. And then you will have to pay your Part B premium. In addition, you may pay a little bit more to the Advantage plan for their coverage. Now, the difference between a Medigap policy and a Medicare Advantage plan is, again, they're both offered by private companies, but government oversight for a Medicare Advantage plan is just through CMS or the federal government. But under Medigap policies, oversight is provided by the State Department of Insurance. That's us. We work under the State Department of Insurance also. But in addition to that, they also have federal guidelines that they have to follow. And the plans work differently. They both require you to have Medicare A and B. Under an Advantage plan, your Part A and Part B benefits, inpatient, outpatient care are covered, and you may have other things covered. Under the supplement, it's only going to cover what Medicare A and B covered. There isn't going to be any extra stuff. It's just what Medicare covers. So if you have dental or vision offered, it's just extra. It's not part of the supplement. Does that make sense? They might have a company that they work with to give you dental or vision, but it's a whole separate policy, and you pay for that separate. And you will pay a premium for your Medicare Part B under both of these. In addition, you will definitely pay a premium for a Medigap policy or a supplement. You'll have to pay that even if you don't use it. And then if you have an Advantage plan, it depends on the plan. You probably won't have an extra premium, but you might. You'll definitely pay for Part B either way, though. So in speaking about this, we see that there can be some pretty stiff amounts coming out of our pocket for health care, right? And we want to think about that. And some of you may be panicking a little bit about that Medicare Part B premium of $202.90. Just remember, assistance is available if you have limited income and resources. We help you fill out those applications and apply for those programs, but there are programs that pay that Part B premium for you. We did talk about this earlier, but preventative care, you can also order the Medicare and You Handbook or your Guide to Preventative Services and get more information about preventative care. And I know you've probably heard a lot on the news about negotiated drug prices for people with Medicare. A few years ago, you probably heard about insulin is $35 or less. Now we've got Eliquis, Enbrel, and Entresto, Farxiga, lots and lots of drugs, negotiated prices, right? But we still have to make sure that those drugs are on the formulary. So yes, you can get insulin for $35 or less as a guarantee under Medicare, but it's not all insulins on all plans. So you still have to sit down and plug your insulin in and make sure it's on the formulary of the plan that you've selected, or you're not going to get it for $35. And the same thing happens with Eliquis and Imbruvica and all these other things that you see on the screen. They are negotiated to make prices lower for you, and they are subject to that maximum of $2,100 per year. But again, it must be on the drug plan's formulary, and you may have to get those drugs 30 days supply at a time. You probably can't get them at a 90-day fill. Okay? So another good service or another good issue about coming to a SHIIP counselor is that we are also cross-trained in the Senior Medicare Patrol Program, which means our goal is to help educate you about Medicare fraud help you learn how to prevent it, how to detect it, how to report it. Those are all very important things. So when you come to a SHIIP counselor, we're going to help you understand how to read your Medicare summary notice and how to report any errors or fraud that you see. 3 years ago, we lost $68 billion to Medicare, fraud and waste, just Medicare scams and fraud. And then last year it was $63 billion. It's now $60 billion. So we are improving, but it takes all of us working on this. So when I say it's very important to read your Medicare summary notice, that's why, because any program that hemorrhages that kind of loss per year is not going to be a sustainable thing. Okay? So we have to make sure we're paying attention. I've had SHIIP counselors who've looked on their Medicare accounts and realized they were billed fraudulently for catheters or for COVID tests or things that they didn't receive or order. And they were able to report those errors and Medicare could claw that money back. So it is important that we're finding out how to protect ourselves against it, how to detect it, and how to report it. And obviously you call us at the Raleigh hotline, or you can come in and see Waylon or me, and we will help you to report it. And as far as detecting, that's easy. You go in your Medicare.gov account and you look at your claims, or you read your Medicare summary notices. And if you see something that's strange, say something. Figure it out, make sure it's legit. But for protecting yourself, honestly, your biggest thing is don't carry your Medicare card if you don't need to. There's no reason to carry it around. Whatever you do, don't give it out to people you don't know. If somebody calls you on the phone and says, I'm from Medicare, do you think they're really from Medicare? No. Medicare will not call you on the phone unless you've made an appointment or they've sent you something in snail mail first. They will mail you a letter saying, someone from Medicare will call you this day and this time. And you will see the official Medicare logo, and you will know it's really from Medicare. So just be careful of what you read, what you hear about, what comes in the mail. Look for official logos. Bring it in. Waylon can verify whether that's actually from Medicare or not. We're trained to do that for you. We can help you understand if this is a scam or just a sales pitch, or if it's legitimately from Medicare or Social Security. If it's not from Medicare or Social Security, you can trash it. But I'm going to tell you, your best bet is to stop answering your phone. I know it goes against everything we were ever taught, because it seems rude not to answer the phone or to hang the phone up. You have to be rude today. I'm just saying, you should not answer your phone. There's artificial intelligence out there now that can record snippets of your voice and then recreate entire conversations that did not exist. When I say it's dangerous to answer your phone, I promise you it's dangerous to answer your phone. If you don't recognize that number, don't answer. Let it go to voicemail. Listen to your voicemail. Do not call that number back. Do a search. If they say, I'm from Medicare, and they leave a random number, if it's not a number you can find under Medicare.gov, then they're lying. They're not Medicare. And so that's what we want to teach you to do, is to legitimize these calls before you pick that phone up. Don't just automatically answer it and assume that the person on the other line is telling you the truth. Chances are they're not. And they spoof calls that look like they're coming even from local numbers. Again, let it go to voicemail. I promise you it's worth the effort. And then listen to your voicemail to decide if you want to return that call. If it's important, they'll keep calling back. But I'll be honest with you, it also reduces the number of phone calls you get from scam calls. The spam folder, it starts to recognize she never answers, and they just stop calling you because you're not worth their time. You don't pick up the phone. So I went from having 50 calls a day to having maybe 2 a day because I stopped answering my phone. So that's my best advice to you. Stop answering your phone. Let your voicemail get it. Every time. Let your voicemail get it. All right, unless you recognize the number. Now, always answer to your mama or your grandmama, right? Like, always answer to people you know, but like, let those others go. Now, when you do come in and see a SHIIP counselor, we are going to help you create a Medicare.gov account. I'm going to tell you that Medicare.gov now wants you to have an email. And they kind of need you to bring your phone to the appointment because you're going to get a code, and that's to keep people from getting access to your account that shouldn't get access to your account, okay? If you don't have a smartphone and you don't have an email, we'll help you figure out a workaround. It's going to be okay, but it is kind of a new requirement, and so we have been asking people, you know, make sure you've got an email before you come in, bring your phone with you when you come, because you're going to have to give me that code so I can help you look in your account. But there are so many benefits by creating a Medicare.gov account. It's the only surefire way that we can give you personalized, effective plan comparisons. We have to log into your account to see specifically what will apply to you and what would be best for you. So that is a big deal. And I know it may seem intimidating, but we're going to hold your hand and walk you through that process. We're going to help you create that account. You don't have to do it on your own. Now, if you have listened to today's talk and you think, wow, I want to help people in my community learn more about Medicare, we need you. I mean, we need you. We need volunteers to do Medicare counseling. You will receive top-notch training. I promise you, we walk you through this process. We teach you everything you need to know. And on the plus side, you get to see me 4 times a year for quarterly training. So just saying, that's a plus, right? And either way, we do need volunteers. We encourage you to come out, talk to Waylon about the job and what it looks like. It's not a paid position, but you do get paid in lots of hugs and thank yous. We help citizens in McDowell County save hundreds of thousands of dollars a year by doing the work that we do. And believe me, the community is very thankful for that assistance. So we could use some help. If you would like to volunteer, just come see Waylon. So if you have additional questions, again, come straight here to the McDowell County Senior Center or call ahead, make an appointment. We'll help you. But you can also call our Raleigh hotline at 855-408-1212. It is a toll-free number, Monday through Friday, 8 to 5, except for holidays. And you can talk to someone at both the North Carolina Senior Medicare Patrol and at the Seniors Health Insurance Information Program. I also put on here the Medicare number for you. It is nationwide toll-free, 24 hours a day, 7 days a week. Someone will answer the phone, 1-800-633-4227. And then, of course, Social Security Administration is 8 to 7, and it is also nationwide toll-free, 1-800-772-1213. They do urge you to call your local office first, and I believe your local office is Asheville. So you would call the Asheville Social Security Administration to enroll or to ask questions. And then, of course, you can always get help by looking at a Medicare101 handbook. They're going to send you one every year once you start Medicare. And you can also order one directly from Medicare. So I will take questions at this time. Does anybody have a question?
I got one for you. So a person that's getting ready to turn 65 this year, how far in advance should they start looking at this?
Okay, so if you're turning 65 in this year, I'm always going to encourage you to start kind of doing your investigative stuff 6 months before. Even though your window to enroll is 3 months prior, start 6 months out, because you're going to want to ask a bunch of questions. You really need to have all the answers kind of in your head and be mulling them. This is not something you can kind of digest in a minute, right? It's a big old thing. It's a beast to understand, and we want you to have all the information that you need. And you've got a lot of stuff to read. So if you want to actually read through all of the documents that we have, the Medicare Basics and the Road to Medicare are the two that I recommend for anyone approaching Medicare eligibility. Come ask Waylon for them. He'll give you a copy of them. Very, very important to have, because they're going to explain whether you should take Medicare or not and what your options are. It will help you make those really sound decisions at the beginning. But in terms of calling Social Security, I would start calling to make the appointment 6 months in advance. So yes, you can only enroll in that 3 months before you turn 65, but they will let you call 3 months even before that to set the appointment in your window. So in other words, if I call in January, I can tell them in January, I want an appointment 3 months from now. Can you get it in this window? Because that's the first month I'm eligible to enroll. So go ahead and start early asking for your appointment, because they're kind of behind. So we want to give them some time. Don't pick this off till the last minute, folks. It's not a good idea. Any other questions? Okay.
Why would it be better for me to come to the SHIIP program here rather than going to a private agent?
So in North Carolina, his question was, why come to a SHIIP counselor versus just going to my insurance agent? And there's nothing wrong with going to your insurance agent, don't get me wrong, but in North Carolina, as well as pretty much every state I know of, agents can only talk to you about plans they contract with or plans that they sell, okay? Which means they've got a vested interest in talking you into a plan that they're gonna get commission off of. Doesn't make them the bad guy, that's how insurance works, right? Nothing wrong with that. But they're only going to be able to talk to you about those plans that they sell. We don't sell anything. And because we don't sell anything, we can offer you unbiased education and information, meaning I have no dog in this fight. So when you come sit down with me, I can tell you about absolutely every plan out there, the good, the bad, and the ugly, and I don't care which way you go. I don't care if you take a plan or you don't take a plan. I'm making the same amount of nothing one way or the other. So my point is, come to us at least initially and let us give you everything, the whole kit and caboodle. And then you can go sit down with your agent, because you already know what you need to know about which plan you want. And if your agent doesn't happen to sell that plan, but you really want it, you would know to back out. Right, and say, okay, I'm sorry, but this is really what I want. If you can't give it to me, I know where I can go to find it. Now, if you come to us, we can enroll you in a drug plan. We can enroll you in an advantage plan. We cannot enroll you in a supplement, but we can certainly inform that decision. We can help you understand all the companies that sell it, whether they're attained age or issue age or community rated. We can tell you if there are any rating classes to those plans, any caveats that would cause them to deny a claim. We can tell you what they should quote you for that policy, if there's going to be an underwriting fee. All of those things are things we can help you understand before you step foot in front of an agent. So you will know the questions you need to ask and how to ask them, and you will know what you want when you get there, so you know exactly what to ask for, and you're not sold a policy that perhaps is not going to be best for you. So that's kind of our goal, is to just inform your decision. We will not give you a sales pitch, and we will not strong arm your decision. We don't care what you do. We just want to help you make an informed decision. Any other questions? You guys were an easy crowd. Everybody gets a gold star for today. Well, thank you again for having me and for your time and attention.
Thank you for your education today.
Oh, thank you. Happy to help.